Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, everyone, and thanks for joining us today. We're here to talk about long-term care facilities and recent federal and state considerations. My name is Myla Reizen, and I'm here with Jackie Hoffman. Jackie, do you want to introduce yourself?
Thanks, Myla. This is Jackie Hoffman. I am a partner in the healthcare group as well, and I'm in the Dallas office. And I'm happy to be here this afternoon to join Myla in the discussion of these pertinent issues in light of the ongoing pandemic.
Thanks, Jackie. Yeah, my name is Myla Reizen. I'm an attorney, K&L Gates in the healthcare group, a partner in the Miami office. And like Jackie, we have similar backgrounds. We represent healthcare providers, and both of us have been spending a lot of time in the long-term care space. So we're really looking forward to having this dialogue right now. And today we're going to be talking about long-term care. And when we say long-term care, we're talking about nursing homes, as well as other long-term care facilities like assisted living facilities. Other podcasts that we've done and alerts that we've done, we've really spent a lot of time on the federal side and the federal requirements, which are very important. But today we're going to be spending some time on the state efforts as well, because the state efforts are really taking it up a notch in many, many states, and it's important to think about the federal and the state at the same time. So with that being said, I'm going to kind of switch over and do a little bit of a context for us in terms of long-term care facilities and why they're so important. And just very, very high level is that there's just been a huge amount of impact in this space in terms of senior citizens and the impact of the virus. The information continues to be very staggering. And the information as of September 27th that was reported on the CDC website shows that there's been, for the COVID virus, that there has been a total of 58,481 deaths. There are confirmed cases of over 245,000, and suspected over 140,000 suspected cases. So those numbers are obviously staggering. And when you compare that to the rest of the population, a recent New York Times article put out there that when you look at it, it represents the deaths that are linked to long-term care facilities represent 40% of all U.S. deaths, but they only represent 7% of the country's cases have occurred in long-term care facilities. So those numbers really highlight the impact on the population that are in the long-term care facilities and what's happening. On the state level, it really varies, but the state level, the percentages of the 40% carries over in many states, and the numbers could be higher and lower, but that's a good range for the state.
Well, let's take a look at the Florida numbers, since that's where I'm from, and there are a significant number of senior citizens and long-term care facilities in Florida. So if we look at the data from Florida and we just compare it over the past month, so as of September 17, 2020, there were 5,337 deaths in long-term care facilities, and that includes residents and staff. And the staff is a lesser percentage than the residents, obviously. And then if you look at the same data, as of October 18th, 2020, there were 6,457 deaths for the long-term care facilities. So the same sort of reporting from Department of Health in September and October. And there is a difference of over 1,138 deaths during that short period of time. So in other words, during that short period of time, over 17% of the total deaths that have taken place during the pandemic in Florida have occurred during this past month or around the month. So that is pretty significant when you look at it. And then if you just want to compare that data to the international comparison to understand what are other countries looking like, the data as of October 16th from Australia shows that in their aged facility and certain of their aged facilities, they have had 675 deaths during the entire time. And they started, it looks like, reporting data from February till now. So if you look at February till now in Australia, you will see only 675 deaths. And I'm not trying to minimize any one death is too many. But if you compare those to the 1,138 38 deaths that we just experienced in 1 month in one state of Florida in the United States. And that's a pretty staggering comparison.
And just stepping back, why is this important to look at the data? The data just kind of tells us about trends that are happening in different locations and what's important to focus on if you're looking at a long-term care facility that has multiple locations. And what we also wanted to focus on today was the importance of the state landscape and state regulations. So in Florida, just looking at the state landscape, there was a lot of activity in the long-term care space in September. On September 1, there was an executive order that allowed for increased visitation in a number of licensed settings, which included nursing homes and ALFs under certain criteria. And it even addressed such areas as the barber shops and beauty shops and the openings of that. In September also, interestingly, there was an ALF rule that required routine testing of staff and then continuing monitoring of staff, and that rule was eliminated. It was not eliminated in the nursing home because there now is a federal rule, but the state rule actually, let me speak a little bit clearer to that. In the nursing home context, there was a similar rule that has been eliminated, but now there is a federal rule, which we're going to talk about, that addresses testing as well. So there was the expiration of state testing in Florida. In September also, there was an elimination of 23 COVID-19 specific facilities around the state, and that's currently transitioning now, but that was announced that it was going to be eliminated. And then September 25th, also there was an executive order which made national attention that allowed for the opening of restaurant bars to 100% and also suspended the collection of fines and penalties associated with the wearing of masks or the refusal of wearing a mask. So at the same time, this is a huge amount of activity in September here related to this population. But at the same time, we're also then seeing a huge amount of federal requirements that are impacting this population related to the visitation and the testing. What's interesting, though, is that on the CMS side related to visitation and testing, that relates to nursing homes and does not relate to the assisted living facilities. So it's interesting as we're talking about the different requirements and when stuff's being expired is that stuff is not then being continued on the federal side. So there are a number of ALF requirements that are no longer in place in Florida. So that's a very high-level summary of Florida and the federal side. And Jackie, I don't know if you want to talk about Texas on your end and their state requirements and federal requirements for the long-term care.
Sure. And let me just jump in with a quick update about what's been going on in Texas. The governor's executive orders in the last week, or as of October 9th, have started to open up things a little bit more. On Wednesday of last week, it was announced that bars that meet certain qualifications are going to be able to open to 50% capacity. The executive order also allows that movie theaters, bowling alleys, amusement parks, zoos, and other businesses are able to go to 75%. But what has not changed is the significant restrictions on visitation to nursing homes. That was all but eliminated with very few exceptions in the last round of the executive order and really has not loosened up. To your point about the statistics, Texas alone has had over 800,000 cases of COVID, over 17,000 deaths, and about a third of those are attributed to nursing home deaths. So the opening up of things in general, but the close watch and restriction on activities in nursing homes is certainly consistent with the concern about those statistics that show significant numbers, both of positive tests as well as deaths that are originating in the nursing home environment. To Myla's point, there are local testing requirements that have been superseded by federal obligations. And so I think that those are the highlights in Texas, where our elderly population is significant, but a little bit more dispersed than what is often seen in the density of Florida.
No, I think that's all helpful. Do you also want to just spend a little bit of time talking about transfers among facilities and within facilities and how that's so important that we've been seeing in the work that we've been doing?
Sure. I'd be happy to. It's really important to keep in mind that nothing about the change in regulations that we're talking about has altered the regular transfer practices between healthcare facilities, between hospitals and long-term care facilities. What has changed is some of the origination locations of the patients because of the nature of COVID. For instance, we are seeing that nursing facilities have to create a segregated unit for their COVID positive or potentially positive patients. So we are seeing what is essentially a facility to facility transfer that is occurring on the campuses of some of our long-term care facilities or assisted living communities. Because those facilities are often co-located or in some form or fashion related, it is critical to remember that for purposes of medical records and transfer documentations, they are separate facilities and they need to be prepared to and to document in the same manner those kinds of transfers from one type of facility to another as if they were unrelated transfers. This means that going from one part of the facility to the COVID unit may require both a memorandum of transfer or something of the like, and may require the opening of a separate medical record in the separate COVID unit or facility, albeit on the same campus as where the patient was previously located.
So in terms of just overall compliance, that we spent some time talking about some of the changes in Florida and then also on the federal side. You know, why is this so important? And I think Jackie and I could just spend a couple minutes talking about that. And then I think most importantly to just talk about some takeaways. These podcasts and trios are meant to have some concrete takeaways for people. And so I think we want to spend, a couple minutes on that. So Jackie, I guess in terms of impacts, I know that we're both aware of the fines that are out there and the recent fines of $15 million assessed for against certain facilities related to both the reporting and infection control issues. I don't know if you want to add to specific issues on your end.
Well, I do think it's important to remember, and to the setting that you launched this discussion for us into, which is the coexistence of both the federal and the state guidance. That doesn't only address issues of testing and masking or segregating of patients, but also the fines that you referenced. So we've seen a lot of attention paid to some of the larger fines coming from or originating from CMS and an uptick in related survey activity. But we also have to keep in mind that a lot of that activity also relates to local licensure, that the survey activity converges at the facility. And so while on the federal level, we might be looking at significant fines, we need to also be sure to keep our nursing home clients and community sensitive to the licensure issues that follow along with those issues for which they're being fined at the state level.
That's an excellent point. And so in terms of just takeaways, let's talk about, now that we thought through kind of the federal side or talked about the state side, what are some takeaways that we would recommend?
One of the first that we recommend is establishing a dedicated employee who is tasked with regularly reviewing the applicable federal and state guidance, documenting and keeping records of the guidance, and reporting developments to the facility executives. Remember, what we've said is that while there is overlap between both the federal and the state guidance and activity, there are also places where they are different, and the consequences of those differences need to be noticed so that the compliance activities satisfy both sets of requirements.
And also one of the things that we've been advising too is that when stuff comes out, to really keep it printed in order to, down the road, if there's a question as to what the guidance was at a certain time, because the guidance is constantly changing, whether it's in the area of the testing or the reporting or the visitation, that over the past 6 months, there's been a lot of movement on the federal and state side. And then these are just some examples. And so I think it's so important to document the guidance that's out there and to document the steps that you've taken. And then also evaluate your own policies and procedures and make sure that they're aligning with the current guidance and what changes are necessary. But that one person is so important because that person can be the person who's really tasked with getting the information on multiple levels. And then also creating a system to be able to make sure the policies are followed is critical as well, to make sure that you have a repository of the policies, but then make sure that they're just not sitting there, but they're actually being looked at and followed.
I want to think about prioritizing and implementing ongoing training for staff that is tailored and delivered in a variety of formats: verbal, written, multimedia. This is really important in the current climate. We're seeing instances where training that ordinarily happens in face-to-face groups or presentations isn't able to happen in the same way safely in the COVID environment. A lot of training is happening online or virtually, and it's really important to make sure that we are not just shifting materials to different media or formats, but we're making sure that the activity of the training itself is effective. One of the things that we've talked about amongst ourselves and some of our clients is the issue of preparedness, not simply going through the training, but implementing some of the steps so that in the event of an urgent situation or emergency, that these steps are already well practiced and familiarized among the staff that needs to participate.
Yeah, and similar to what Jackie is saying is really to do some self-assessments, mock surveys, and really step back and see where you are in terms of responding to everything. And like the example of the transfers, where does your facility sit with that so you're not doing it for the first time? Also, like we had talked about earlier, the decision-making process and documenting that. And then also to think about if you're under any sort of other obligations, such as a corporate integrity agreement or a compliance program that's mandatory, is that to really think about how these policies and requirements that we've been talking about really fit into that and make sure that that is all seamless as well.
Also, we know that a lot of the listeners are part of larger systems, either of like providers or with varied providers. And often, to Myla's point, the compliance programs, practices, privacy practices are coordinated. And so the issues that you might be dealing with in your environment may not exist or exist in a slightly different fashion in a related facility. It's important to make sure that as an organization, you are both at your location coordinating these activities, but also making sure to coordinate with the larger system and those individuals who are responsible for compliance across the ecosystem of your organization.
And I think those are some of our real highlights that we wanted to offer for you today. In conclusion, we just want to thank you, and we're going to continue to put out information on this area. It's an area that's so important to everyone right now. And if you have any questions, reach out to us if anything you ask, but I also refer you to our website where we have a lot of information on different resources and podcasts and alerts that we've done over time. With that, we just thank you very much for joining us.
Thank you for your time this afternoon.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.